Cayman's most senior advisor on healthcare matters, Chief Medical Officer Dr. John Lee, is settling into his new role. Already, he started honing local health surveillance processes for detection of diseases. Most recently, he hosted a special seminar on Ebola. While the risk is low in the Cayman Islands, developments relating to the disease cannot be ignored. Joining me now to discuss this is Dr. Lee. Dr. Lee, thank you so much for your time and congratulations on your post.
Thank you very much. It's a great opportunity, and I'm very excited about taking up the new role.
Now, in this new role, you've already pretty much hit the ground running. You started off with an information session on Ebola. Tell us about that. Why would you feel it was important, especially at this time?
Ebola has been raised to the level of a public health emergency of international concern by the World Health Organization. And when that happens, a lot of attention gets focused on it, even though it's been an issue for the last well over a year in the Democratic Republic of Congo. But because it's raised that level, we've been advised by PAHO, the Pan American Health Organization, and by the World Health Organization to tighten up our processes around how we would manage if there were any problems related to Ebola, like somebody arriving on an airplane. So we've held meetings with the various related health professionals and also been in communication with the border control agencies as well.
Now, the risk of Ebola here in Cayman is quite low, but what would you tell residents of Cayman? I mean, just to be alert, to be aware, etc.
I think, yes, that's it. Whenever you go abroad, you need to be careful about where you go and what you're exposing yourself to. And if you ever have any symptoms that you think, and you've been in a place that's at risk, whether it's Ebola or any other infectious disease, report them early so that the health authorities can take the proper controls to protect both yourself, your family members, and the public as well.
Now, Dr. Lee, it's not just Ebola that you're working on, too. You actually have other plans in place. Can you just discuss some of the other initiatives that you're working on in your new role?
Indeed. Unfortunately, infectious diseases don't leave us, and they're all over the world. We know about the measles threat that's currently affecting the Americas. There are many neighboring countries around who've been affected by measles. There's also the constant threat of dengue, and there have been outbreaks, particularly in Jamaica and other countries, which cause deaths every year and have done again this year. So in the background, we're always alert to the threats to the islands and what we would do should there be an issue.
And what do you see your goal as in your new role? I know you have a lot to get around. You've worked at the HSA for many years, but what's your role? What's your goal for this new role?
Indeed, it's a very wide tableau that I've got to work on. One of the key issues that I'm interested in is introducing standards right across the board in healthcare. Not that we don't have standards, but some of them are quite invisible. So a lot of organizations may have standards, but they're not demonstrating their success and sometimes their failures to the public. And I really would like to introduce a lot more transparency so the public know what great services we have, and to know that when anything goes wrong, that we're properly looking into the issues and taking protective steps to make sure they don't happen again.
And you also mentioned in your role, it's not essentially HSA related. You're actually seconded to the ministry, so tell us about that.
Indeed, I don't work for the HSA at all, although I do have privileges there. I often spend time there. I have a lot of meetings there, but I work at the ministry, so I'm employed directly by the ministry, and I'm at the 5th floor with all of the minister and his team.
And you do also plan on doing some campaigns, I guess, in the future, just to raise public awareness about things that you said before about Ebola, about traveling, etc. Is that one of your big focuses, too, as well?
And in particular about non-communicable diseases.
Yes.
It's one of the big areas that we could do so much about. Keeping ourselves fit, stopping smoking, taking good care of our diets, taking medication where it's warranted, attending early at the doctors to have the proper checkups. We really could do a lot more for non-communicable diseases in Cayman and in the region in general, and there are lots of initiatives that are becoming along line within the next 6 months to a year, I hope, to help people to do the right thing.
All right, and Dr. Lee, we have run out of time, but any final thoughts?
No, I look forward to doing the job enormously, and I'm very thankful for the opportunity.
And thank you so much for your time.
Thank you.